Welcome once again to AARP, Arizona Hispanic Connection Update. I am David Parra with AARP, of course, and I have with me Matt Jewett. Is that how you pronounce your last name?
That is correct, David.
And Matt is with Children's Action Alliance, and we are going to blame Marco Mendoza from the Area Agencies on Aging that connected the two of us to do an update on a very important topic. And first of all, Matt, welcome and thank you for agreeing to join us for this update.
Absolutely. Glad to be here.
So you are with the Children Action Alliance. What do you do there in brief?
Right. I am the Director of Health Policy, and Children's Action Alliance is a voice for children in the community and at the state capitol with our leaders. And we're really involved in research and advocating for the well-being of children across our state.
Perfect. Thank you for that. And you know, I was kind of thinking that the COVID-19 emergency declaration is basically coming to an end. Can you, in a nutshell, explain what an emergency declaration is and then link it to COVID-19?
Yeah. So during the COVID-19 pandemic, the federal government took action to make sure that people had the health care they needed to stay healthy. And one of the things that happened was that states were prohibited from basically dropping people off of their Medicaid rolls. And in Arizona, Medicaid is known as AHCCCS, the Arizona Healthcare Cost Containment System. And basically, if people passed away or they moved out of state, they could be disenrolled. But usually people have to re-enroll or renew their access enrollment every 6 or 12 months. And if people did not do that during the pandemic, they were not kicked off of their coverage. Also, if people's income went up and they no longer qualified because they were over income, they were also not dropped. But now, since April 1 of this year, Access and other states will be doing the same thing, is now dropping people from their Medicaid rolls if either their income has gone up and they no longer qualify, or if they have not completed their renewal information.
So is the thought here that when there's an emergency declared, then there's a lot of funding that is released to basically help with the emergency, which was the case. I mean, we had I think it's fair to say a tragic, that hit us with the COVID-19. And obviously there needed to be a lot of help because a lot of people needed all kinds of help. But the case in point here is health insurance to stay healthy, etc. Many people lost jobs and therefore their health coverage. Yes. If you agree, Matt, why don't we go again and kind of go a little bit more into detail of what you just told us. So
yeah.
So basically, if we go and tackle access first. So the Access program is the Medicaid at the federal level. We know it as Access. It provides several benefits, but namely the health insurance plans. And so what are we talking about here? What's going to happen now that the emergency declaration is ending? How long do they have people to take action, and who is going to get affected?
Yeah, there are 2.5 million people across our state who are enrolled in Access through various categories. And of those 2.5 million, about 650,000 of them are the folks that we just mentioned. Either Access has reason to believe that they are over income for the traditional limits of Access, or that they have not completed their renewal information that they're supposed to do every 6 or 12 months, depending on the population. And so of those 650,000 people, Access is going to go back and give them new renewal dates over the course of the next year. And they will be contacting people and saying, okay, it's your time to renew now. And if you don't renew, you could be dropped from coverage. If we find that you are over income, there will be other options that are available. If they are children, they could go into kids care, which is the Access program for families who make a little too much for access, but they still don't have private health insurance that they can afford. Or for much of the rest of the population, it could be moving into the health insurance marketplace through healthcare.gov or the Affordable Care Act. Also, for many seniors or people with disabilities, they, of course, have Medicare. And so there are some people who are dually eligible who have Medicare and Medicaid through access. And so those are folks who we'll talk about in a moment, but have some more options with Medicare in terms of what they can do.
Now, people need to sign up for Medicare at a specific point, 65. When they turn 65, they can stay off Medicare if they have insurance through their jobs.
Right.
So are we saying that there were people who, because of the pandemic, they were due to enroll on Medicare, but because of it, they couldn't do it? So now there's a late enrollment penalty, usually. So
Right.
what in this emergency declaration, how are they going to get help?
Yes. Well, it's a process to get back to normal after the pandemic. I think many of us have felt that in our jobs. And so one of the things, excuse me, that the federal government is allowing is people who are enrolled in Medicaid and were happy with their coverage and had other things going on may not have enrolled in Medicare when they became eligible. And as you said, there is usually a penalty unless you have your employer-sponsored insurance for enrolling late. Well, that penalty has been waived for the next year. So if you lose your Medicaid, one of your options is to enroll in Medicare if you are Medicare eligible. And you may think, oh, but I didn't sign up on time. Am I going to have a penalty? Well, if you do that soon, when you lose your Medicaid, then you will not have to worry about that penalty. And the other thing is that you may be you may already be enrolled in Medicare and Medicaid together, but you may now have some increase in income and no longer be eligible for Medicaid through access. So now you just have Medicare. Well, normally with Medicare, you have to wait until open enrollment at the end of the year to change plans. But this is one of those special qualifying life events. If you lose your Medicaid coverage, you can actually go back and join a Medicare Advantage plan with drug coverage or a Medicare drug plan, a Part D plan, even without waiting until open enrollment. But you have to do that right after you lose your coverage. And so if you do that, then you can actually change your coverage in Medicare during the course of the year before open enrollment because you've lost your access coverage.
Got it. So basically what I'm hearing is that the government is going to be very, very careful in basically moving away from the provisions that were in place with the COVID-19 emergency declaration ending. And they're going to be very careful. I understand they're going to take about a year for all this process.
That's right. In fact, they realize this isn't all going to happen at once. And for example, with access, 650,000 extra people whose renewals they have to process in addition to the rest of the couple million people that are enrolled in access who have to keep renewing. That is way too much work. They couldn't do that all at once. So to make sure nobody falls through the cracks, they will be doing it kind of little by little. And consumers are being given time because they understand that people need to be able to make these changes and won't necessarily be aware of them overnight.
So let's put ourselves in the minds of people that may be worried. Nobody's all of a sudden just lose coverage, correct? They're going to be sent something on the mail. I suppose it's going to be on the mail. So they need to be on the lookout for that. And again, nobody's just going to all of a sudden lose coverage. It's going to have to be correspondence with the entities, and then they're going to have to read it carefully and then respond accordingly, depending on what they're being asked. Correct?
Yes. This is a return to kind of the normal situation. So especially for those who are enrolled in access, it's very important that people keep their contact information up to date. We have about 650,000 of those 2.5 million Arizonans who are enrolled in Access, who, if not for the pandemic, basically would have been dropped from coverage already, either because they were over income or they didn't complete their renewals. So some of those people may not, Access may not have their contact information. So it's important for people to keep their information up to date if they've moved. Access will also be contacting people by text and email if they have that information. But you can make sure, if you are enrolled in Access, that they have your information. You can call the number on the back of your card with your health plan. You can also visit the website health, the letter E, Arizona.org. Or you can also meet with a navigator or a sister who work for nonprofit organizations that will help you go over your options and what's best for you. And you can find those, and they're available all throughout the state, by calling 211. And for those who need help with Medicare, so if you're trying to transition from Access into Medicare, you can call the State Health Insurance Assistance Program, or SHIP. And the number's on the screen there, 1-800-432-4040. And that is operated by our friend Marco Mendoza from the Area Agency on Aging. And they are accustomed to helping people all year round, and especially during open enrollment. And they are standing by to help right now.
Matt, thank you so much. I think it was well worth it that we did this update. I think a lot of people will be helped with this information. So again, thank you so very much. And we hope that you can join us in the future for another update.
I appreciate it, David. Looking forward to it.
Thank you so much. And thanks to all of you who join our program. We'll see you next week. Take care.